I'm so happy you're here and taking this really positive step towards learning more about surrogacy and what you can expect on your journey. Let me tell you a little bit about me and how smart surrogacy came to be. My name is Ariel Taylor, and I've dedicated my life to surrogacy education and fertility support. I'm a social worker and a psychotherapist, and I'm also a 5-time surrogate and a 6-time egg donor. I think the surrogacy process goes so much better when we do this openly and honestly and collaboratively. And I really love being able to still be in the lives of the kids that I've carried as a surrogate and the families that I've donated my eggs to. It's rewarding, it's special, and I'm really excited to walk this journey with you as well. Since opening my practice in 2021, I've counseled hundreds of surrogates and intended parents, and I've learned a lot, both professionally and personally. Typically, I see people when things are not going super well, and they seek me out because there's been a loss or a challenging diagnosis or a relationship breakdown. And at this point, I was doing damage control, and I was helping people after the fact cope with these challenges that had come up. And what I figured out is that they all had something in common. They rushed into matching. They were not educated beforehand. They didn't take time to build a relationship with the surrogate, or surrogates didn't take time to build a relationship with the intended parents, all before the pregnancy happened. And they would compromise on things that were important to them, or maybe on things that they didn't even know were important for them, because they wanted to secure a match as quickly as possible. And by the time people would come and see me, they were not feeling good about their journey. They were not feeling good about the match or their experience overall. And had they known more in the beginning, they probably would have made different choices. Even intended parents that put in the effort to research often fell short because the information that you can find on the internet isn't always coming from credible sources. A lot of it's hard to find, and in some cases, it's not even available. So how are intended parents possibly supposed to make good choices and ethical choices when they can't even find the information? How can you set yourself up for a more positive experience and finding a well-qualified match, either through an agency or on your own? And how do you know that this agency is operating ethically? If you're searching on your own, how do you know what makes a good match? And what is the best way to find a surrogate? And once you do, how do you actually go through this process the right way? These were all questions that were coming up regularly when I was talking to intended parents, and it's exactly the reason I created Smart Surrogacy. Because you deserve to feel good about this experience. Your baby and your future family deserve to feel good about their experience, because this is the normal way that your family is being made. So my definition of surrogacy is that this is a collaborative process between a carrier and intended parents, with the common goal of helping those parents bring their baby home safely. In order for this to be surrogacy, this arrangement must be put in place prior to the pregnancy. If either party is being forced into the arrangement, that's not surrogacy. That would be exploitation and forced birth. And if a woman, for example, agreed to be pregnant and then give that baby to a set of parents, that's also not surrogacy. That would be a planned adoption. If a couple that is not romantically involved decide to have a baby together and co-parent that child, that's also not surrogacy. That's just called co-parenting. We have to be so careful when we use terminology that we're using it correctly and being clear about what in fact this is. The most important point about surrogacy is that this is collaborative, and it involves everybody working together. It involves everybody consenting to the same thing, and everybody has the same goal right from the start. So we have two different types of surrogacy. We have gestational surrogacy and we have traditional surrogacy. Gestational surrogacy is the most common, and this is where the intended parents have already created embryos using their own eggs and sperm or that of a donor, and that embryo is placed into the surrogate's uterus via an embryo transfer. With gestational surrogacy, the surrogate is not related to the baby she carries. She's only the carrier. This is why you may also hear the term gestational carrier, which I actually think is an even better description than just using the word surrogate, because it implies the reality of the situation, that the surrogate is just carrying a baby that belongs to somebody else, and she's not the biological mother. I personally don't love the term surrogate mother, and that's because I think it implies some sort of maternal bond between a surrogate and the baby she carries, which isn't accurate. Surrogate, if we look at the translation, actually means in replace of. So when we use the term surrogate mother, we're saying in replace of the mother. And we mean that to imply that the surrogate is using her uterus to grow this baby instead of the baby's mom. But what this implies is that perhaps that surrogate is replacing the mom in some of these maternal aspects. And that's not really reflective of what surrogacy is. And it's certainly not reflective of same-sex couples who may not have a mom to begin with. I think it's really important that we use terminology that really sets the expectation for what this is. And so when we use terms like gestational carrier, it helps people wrap their head around the fact that this is someone gestating a pregnancy and they are a carrier of somebody else's baby. They are not replacing the mother. They do not have a maternal bond to the baby they are carrying, and they are not the biological mother of this baby at all. The second type of surrogacy is traditional surrogacy, and this is much more rare now that IVF has advanced so far. In traditional surrogacy, the surrogate also acts as the egg donor, which means that she is biologically related to the baby. The reason that this is a lot more rare is also because the qualifications for an egg donor and a surrogate can be quite different, and it can be hard to find one person who falls into both categories and is even willing to be a traditional surrogate. So, for example, it's strongly advised that surrogates are finished growing their own family before pursuing surrogacy, because there are risks to your own fertility, although they are small. Women up to 40 and sometimes even slightly older may still be excellent candidates for surrogacy depending on their health and birth history. But for egg donors, ideally, it's best that they're under the age of 30, and some clinics recommend even under 28. They also must go through genetic and DNA testing, as well as rigorous family history health interviews. So if she's a carrier for any genetic disorders or has a family history of significant illnesses that can be passed down, or maybe she's a carrier for something that's incompatible with the other parent, she wouldn't qualify as an egg donor. But none of those things are relevant if she's just a gestational carrier. So this, combined with the fact that many couples pursuing surrogacy have already created their embryos, traditional surrogacy just isn't as common anymore. So let's go over the things that are not surrogacy. So like I mentioned before, if anyone is being forced into an arrangement, that's not surrogacy. Consent has to be obtained, and it's also the reason that surrogates have evaluations with social workers and the fertility clinic beforehand to ensure that they're informed and consenting of their own free will. If there is sex involved, that is not surrogacy. In fact, if there is sex involved, that impacts your ability to get parentage of this baby. Surrogacy must be through some form of assisted reproductive technologies, and it should always be done at a fertility clinic under the direction of a fertility doctor. Now, when we talk about the legal aspect of surrogacy, there's also a few requirements in order for this to be a legitimate surrogacy arrangement. The surrogate must be over the age of 21. Also, the surrogacy arrangement and your contract must be put in place and signed before the pregnancy happens. If not, you can run into some major legal aspects getting parentage of your baby. This is the reason that your fertility clinic is going to require a copy of your signed contract before they plan the embryo transfer. The best surrogacy arrangements are the ones that are ethical, follow the guidelines and laws, and don't leave any room for interpretation. Okay, I know you've probably heard some wild myths about surrogacy, and some of them are pretty obvious, but here are some myths about Canadian surrogacy that you might not know. So let's learn together so that you can be informed and educated. Myth number 1, you have to match with a surrogate through an agency. This is a pretty common misconception, and many intended parents believe that they must use an agency in order to do surrogacy in Canada. You do not. In Canada, an agency cannot legally be paid to match you with a surrogate. So while you might think that your $30,000 agency fee goes towards securing a surrogate, it does not. In fact, many Canadian agencies have wait lists of about 12 to 18 months and up to 200 intended parents waiting. The alternative to using an agency would be to find a surrogate independently, which basically just means that you found them anywhere else except being assigned to one through an agency. That's it. The rest of the process is identical. If you don't use an agency, you still use the same lawyers, you still use the same fertility clinic, and all the steps are exactly the same. and you would build your support system through your own network. This could be peer support groups, a therapist, Facebook groups, friends and family, taking courses like this one, and of course, my intended parent program, which would follow and support you through the beginning of your journey all the way to the end. Myth number 2 is that surrogates in Canada are paid under the table or given gifts to make up for the fact that they can't be paid. I cannot tell you how often people think that this happens, and it's completely false. Many people believe that surrogates in Canada are given thousands of dollars in gift cards, cars, tummy tucks even, because they can't be paid. This does not happen. And if it does, or you hear of it happening, it is 100% not okay. And you can really get into some hot water as an intended parent. Surrogates in Canada are reimbursed all of their expenses up to a cap. And typically that's about $25,000 to $30,000. And you're required to have a receipt and a signed declaration form for that reimbursement to be legal. The guidelines specifically say that these type of non-pregnancy related gifts or large expenses, they're prohibited, and intended parents can be fined if they are caught. On this topic, you should also never, ever feel like you have to entice your surrogate to match with you. If an individual surrogate messages you or an agency suggests that you should offer additional perks in order to match, this is a huge red flag and it's really unethical. Speaking from a surrogate's perspective, being reimbursed expenses is completely fine. There is no need to go over and above on lavish, expensive things to make up for not being able to pay them. Surrogates in Canada are choosing to do this. They are consenting to being reimbursed their expenses. While you can do something like, a reasonable Christmas gift or a care package or flowers, normal things like that, I would strongly suggest avoiding things like cash or large amounts on gift cards, cars, vacations, or surgery. And I know that sounds crazy, but this is something that I am seeing come up way, way, way more often. You do not have to compete against other intended parents on who can give the most expensive gifts or the most perks. That is not okay, and you should never feel like you are being exploited in that way. Myth number 3 is that an agency or the lawyer or the surrogate is responsible for the receipts. This is the most common misconception I see, and it's actually one of the reasons a lot of parents go with an agency because they believe that they are the ones responsible. Regardless of if you are working with an agency or if you find your surrogate on your own, you as the intended parent are the ones responsible to prove that you did not pay your surrogate. That means that you alone are required to have copies of the receipts and the declaration forms, not the agency, not the surrogate, not the lawyer. If you were ever investigated, and this is a big if, because so far no intended parent has ever been investigated, you would need to produce copies of all of your documents along with your transaction records that match. And if you're working with an agency, you need to make sure that the receipts and the declaration forms are provided to you. If an agency were to close, for example, which has actually happened to a few of them recently, all of those records are gone and you have no proof of your journey or those expenses. Now, don't worry, because I have tons and tons of tips for receipt management and staying organized, as well as everything you need to do this really easily and within the law. There are even handy apps that can help track all of your expenses. You don't have to worry. It's simple, it's easy, and even though maybe it appears that it can be really, really difficult and you might need somebody else involved, you don't. It's really simple, and I'll teach you how. So myth number 4 is that independent surrogacy is a way for people to go under the table or around the rules. I personally think this myth might have been created by agencies, but the fact is that what we call independent surrogacy is really just surrogacy, because independent only refers to how you find your surrogate. It has nothing to do with the process itself. All surrogacy journeys, whether you match at an agency or whether you match on Facebook or whether you match with a friend or a family member or a complete stranger, every single surrogacy journey follows the exact same steps. But there is this myth out there that people choose to match outside of an agency to cut corners. This is false for a few reasons, though. Number one, it's the fertility clinic who ultimately will pass your surrogate to be your carrier. And this is only after a thorough medical evaluation, psychosocial assessments. So regardless of where you find your surrogate, they're still going to need to pass all of those at your clinic in order to qualify. So if you're presented with a surrogate who you don't feel meets the qualifications, or you're being asked to switch clinics to one specific doctor in order to approve that surrogate, or if anyone suggests that you forego a contract or skip medical testing or steps, you're going to be able to know that that's not okay, and you're going to be able to advocate for yourself. We can prevent a lot of bad practices by putting the right information in your hands. And when you're armed with the right information, no one's going to be able to pull something over you. Ultimately, this means that whether you match with an agency or on your own, you're going to match with a well-qualified surrogate, and you're going to be far more likely to have a really positive experience. There's also some misconceptions about children born via surrogacy. So let's clear that up, because chances are you're probably going to get at least one person that has one of these questions for you. Myth number 5 is that babies born via surrogacy have this inherent trauma or psychological damage from being taken from women who give birth to them. The reason this myth is so prevalent is because a lot of the studies that we have are actually on adoption, and they're on birth mothers and children being separated because of adoption. But that doesn't apply to these situations in surrogacy, because this is a lot different than adoption. Surrogacy is a conscious choice that everybody's going into and consenting to for intended parents to have their own baby. So this myth is completely not true. And in fact, we actually have a lot of research that shows that babies carried by surrogates have just as good of outcomes as babies carried by their own parents. And this is because surrogacy is not about taking babies away from somebody. It's about giving that baby back to the parents. And I always say, as a surrogate, I don't want someone else's baby. I'm happy to carry them, but I carry this baby so that you could have your children, not so that I can have another baby. And I think it would be kind of weird to want to keep somebody else's baby. So in recent studies, we know that children born via surrogacy do not have any negative feelings towards their parents, their surrogate, the surrogacy in general. They have similar health and education outcomes. And some studies are actually showing that children carried by surrogates actually have better outcomes. And this is likely because those pursuing surrogacy tend to have higher incomes, higher education, more resources, more family support, and they're having a baby intentionally when they are ready to do so, which of course isn't always the case for babies that are conceived spontaneously. Where we do see any potential negative effects is when children are not told about their conception. So for children who found out as adults that they were carried by a surrogate, or they were lied to at any point, they tend to have more negative feelings towards surrogacy and towards their parents. But this isn't because of surrogacy. It's because of deception. And it's why honesty is always the best policy. Ultimately, your child should feel really proud about their story, and they should feel that they are so special, that so many people came together and worked together to help bring them here. And remember, you as a parent, you're in charge of this narrative, and you're in charge of how they are going to feel. And that's also a direct result of how you feel. It's also the reason that it's so important that intended parents are mentally and emotionally ready for surrogacy, that you are prepared to have these conversations, that you have had conversations with your family and friends, so that when you do have children born via surrogacy, you can really make sure that they are feeling positive about this entire experience. Myth number 6 is that intended parents are not going to be able to bond with their baby in the same way. And of course you will. There are so many ways that intended parents can bond with their baby. You might record an audiobook or send special music clips of your favorite things to your surrogate so that they can play it for the baby. You might attend appointments or be able to feel the baby move. And you're also going to start preparing a space for them. While your surrogate is pregnant, the bonding is really about you feeling close to the baby and feeling close to the pregnancy. Your baby is going to bond with you once they're born. If you can, being able to visit your surrogate and be part of the pregnancy can be really special. And remember that dads never carry their own babies, and they are able to bond with their children just fine. I hope that clearing up some of these things helps you feel more ready for your surrogacy journey and maybe able to set the record straight with some of those around you who might have questions. And remember, this is your normal. This is the normal way that you're going to have a baby. And I promise you, your baby and your child is going to be a regular, normal kid, just like everybody else. They just happen to be carried by a surrogate. Here's a little cost breakdown of what you can expect for your journey ahead, and this will help you be a lot more financially prepared. So one of your biggest costs is going to be an agency fee if you choose to use one. So agency fees can range anywhere from $15,000 to $30,000, and they all offer a little bit of different things. But typically the idea is that they're going to facilitate your journey and act as a liaison between you and your surrogate and the clinic and the lawyers and be able to do a lot of things on your behalf. Now, for a lot of intended parents, maybe that's not always necessary. I find a lot of intended parents typically have some type A personalities and like to be a little bit more in control of their journey. And chances are you're going to be doing a lot of this communicating yourself anyways. So an agency isn't always necessary, but it can be helpful depending on the type of support that you're looking for. But just be expecting that they are going to be a big part of your financial obligation to surrogacy. Now, the next big large cost is going to be your surrogate's reimbursements. So you can expect anywhere between about $25,000 to $40,000 in total for the duration of the pregnancy. And this is going to include things like her postpartum lost wages, potential extras like fees associated with multiples or a C-section or bed rest if required. Now, keep in mind that these reimbursements do not start until after your surrogate is confirmed pregnant. And they're also reimbursed in monthly equal installments. So for example, if your surrogate has a total reimbursement cap of, let's say, $30,000, the way that's going to be worded in a contract is that after she is pregnant, typically it's worded like the first of the month following a positive beta or a second positive beta, you're going to do these in monthly installments. So it might be $3,000 a month for 10 equal months for the duration of the pregnancy. So legal fees can be anywhere from $8,000 to $15,000, and this includes 2 separate fertility lawyers. So one for you and one for your surrogate. This fee is going to include your contract, the hospital letter, and all of the post-birth paperwork that's going to grant you parentage of your baby. This is never, ever, ever a step to skip. It is required that you have 2 separate fertility lawyers. If you use the same lawyer, that is a huge conflict of interest because if there is a breakdown or something, one lawyer cannot represent both parties. The other thing is that it's really important that you use a fertility lawyer. Do not use your cousin's friend who does real estate law. There are a lot of really specifics that go into a surrogacy contract, and you want to make sure that you are working with somebody that really, really knows the law here. Now, psychosocial assessments for medical screening are about $400 to $500 depending on the company. Your clinic may require one for your surrogate and one for you as well. So you could expect to pay between $500 to $1,000 for these in total. These should always be done by a registered professional, either a social worker, a psychotherapist, a psychologist, and they can be submitted to your insurance for reimbursement. Carried with Love does provide these for intended parents, and we charge $420. These are done by registered social workers, and we do a very comprehensive job. When I started my company, it was really, really important that I was putting in place resources where intended parents could make sure that they were getting good information and good clearance. So we follow the very specific guidelines set out by the Canadian Fertility and Andrology Society, as should any other regulated professional that is doing these assessments. This is what's going to make sure that your surrogate is consenting, she is fully aware, she has been informed, and she really is choosing to do this from her own free will, and that there's no indication that anything, is going to prevent this from going smoothly. Now, medical screening at your clinic is roughly between $5,000 and $10,000, although they do vary a lot and by clinic. So some clinics will have packages that might include all her screening and transfers, And so that might be a little bit on the higher end. Some clinics will have a lot more of an a la carte type style. So the best thing that you can do is contact your clinic and have them send you a full list of what those costs will be. They should be able to give you a really clear breakdown of all the costs associated with surrogacy. Now, a separate category of reimbursable expenses to your surrogate is pre-transfer expenses. So these are going to be for trips to the fertility clinic for medical screening and transfer. So if you have a local surrogate, these things are going to include kilometers, meals, childcare, lost wages, and they're not going to be too pricey. You're probably looking under $1,000. Now, if your surrogate is in another province, these pre-transfer expenses are also going to include things like flights, hotels, rental cars, or Ubers, in addition to childcare, lost wages, and meals. So if you have a surrogate that is not local to your clinic, I would budget at least $3,000 to $5,000 for each time she has to go to the clinic. Now, typically contracts are worded so that your surrogate is allowed to bring a support person. So if you are paying to have your surrogate fly for a transfer, you likely will be paying for a second person to come with her, which also means that you're going to be paying for their flights, their hotels, their meals as well. So embryo transfers themselves do vary by clinic, but they're roughly about $1,000 to $3,000. They may also be included in that surrogacy package. So definitely contact your clinic, get a complete cost breakdown. This is going to help you know what to expect. So medications also have a very large range of costs, and this is going to depend on your surrogate and her protocol and the clinic and whether or not your surrogate is willing to use her insurance. So in general, you should budget about $5,000 to $10,000 minimum for medications. This is going to increase if you have to do multiple transfers, if you have to do any type of additional medications or injectables, or if you've had multiple failed transfers and they want to do additional testing. So keep in mind that $5,000 to $10,000 is going to be the minimum. Now, most insurance companies will not cover things like injectable medications, but they will cover things like the estrogen. So if your surrogate does have unlimited prescription coverage, for example, which many extended benefits do, these can be kind of just included under her insurance, and they're not pricey, but it can help just a little bit. The injectables are the ones that are going to be the most costly. Now, sometimes clinics will actually provide all these medications to your surrogate. So you would pay the clinic directly, and then they would ship all the medications to your surrogate. So again, a question to ask your clinic just to see what their protocol is with that. So other miscellaneous costs that you might come across will be things like 3D ultrasounds or elective prenatal testing or any additional transfer prep like acupuncture, for example. Other things might be any testing that needs to be done after birth or any procedures. So if you choose circumcision, that is going to be an out-of-pocket cost. The other thing to consider is that your travel to your surrogate for the delivery is going to be an additional cost. Now, if you're a local, this is going to be pretty minimal. But if you're coming from overseas or any other countries, this is going to be a little bit pricey. And I would suggest that you arrive at a minimum of 37 weeks, maybe even a little bit earlier, depending on how a pregnancy is going. And you can expect to stay in Canada for about 4 weeks after the birth, because in order to travel back, you're going to need the birth certificate. So this is something to consider when you bring in those costs as well on what that might be. You might choose to look into Airbnbs and hotels in the city that you're looking to do surrogacy to get a little bit of an idea on how much this might cost and how much to budget for that time of your journey. So how are people affording surrogacy? Well, the answer to that is a lot of different ways. Now, many IPs will take out loans or a line of credit, or they'll pull from their savings. They might cash out their 401ks or even get second jobs. Some intended parents get really creative and they'll do fundraising, or maybe they'll ask their friends and family to help contribute to their journeys in lieu of things like Christmas or birthday gifts. Sometimes people may even get their inheritance early from family members in order to fund this type of journey. I would suggest at minimum having about $40,000 in your account ready to go for your surrogate's reimbursements and the initial cost of your journey. And you might also choose to be open with your friends and family about the cost of surrogacy and see if that they are willing to help. So for intended parents who are in Ontario, you may be eligible for IVF funding through the government. Now, Ontario provides everybody with one funded cycle of IVF, not including medications, plus an additional cycle if they are acting as a surrogate. So this can help with some of the costs associated with the clinic, but it does require that your surrogate is also in Ontario. She has to be under the age of 43, and she has to have not already used her funded IVF cycle for surrogacy. If you're looking for additional funding, there are grant programs available for intended parents. So Fertility Friends Foundation offers a $5,000 grant twice yearly. The application is $40 and you can easily apply online. And for those pursuing surrogacy, which is you may be eligible for an additional $5,000 grant through Not My Tummy on top of this amount with Fertility Friends Foundation too. Modern Miracle Foundation also has a grant amount that's given quarterly, although the amount is not specified because it depends on funding. Their application fee is $50, and you can also apply pretty easily online. So what does altruism surrogacy really mean in Canada? This is a soapbox that I refuse to get off of because people have some very, very strange opinions on what this actually looks like. Many people understand altruism to mean that surrogates in Canada cannot be paid. In fact, if you look through any of the surrogacy Facebook groups, you're going to see this come up often. And sometimes there's this idea that Canadian surrogates must be doing it for the right reasons because they can't get paid. In fact, sometimes people specifically choose Canada because they believe that their surrogate here is going to be more likely to be doing this for the right reasons and not just in it for the money. And sometimes there's this idea that those are going to be more desirable than surrogates who are fairly compensated. So while this is technically correct, surrogates in Canada cannot be compensated and they must operate altruistically. Our understanding and our usage of these words is really confusing. Number one, you can do something for the right reasons while still being compensated. Those two things are not mutually exclusive. For example, there are lots of people who love their jobs and are in helping professions. I am one of them. I love my job. I do it because I want to help others. And I enjoy my work and I find it fulfilling. And you would say that those people chose their jobs for the right reasons because they want to help people. However, they're still going to be paid for the job that they're doing and the effort that they are putting in, or they wouldn't be able to do their job. No matter how much they enjoyed it, they wouldn't be able to do it for free just because it involved helping somebody. And in surrogacy, it should not be implied that if somebody is paid, they're somehow not as good. Now, secondly, altruism does not mean for free. This is a really, really big misconception, and sometimes it leads intended parents feeling this sense of sticker shock when they find out that their Canadian surrogate is actually reimbursed between $25,000 and $35,000 on average, plus extras like lost wages or bed rest, maternity leave top-up, a doula, for example. So they might end up spending about $40,000 between all of the different reimbursement categories when they were under the impression that Canadian surrogates didn't cost anything. Number three, and maybe one of my biggest issues with altruism in Canada, is that altruism only applies to the surrogate. The surrogacy industry in Canada as a whole is very much for profit. So the doctors, the lawyers, the counselors, the agencies, all of those people are legally allowed to profit from surrogacy. But the surrogate herself is not allowed to profit. So let's take a little bit of a closer look at some of these definitions. So the meaning of altruism actually means an unselfish regard for or devotion to the welfare of others. So basically it means doing something because you want to help and not because you're doing it selfishly. A little bit of an issue with this because I would say that choosing to be a surrogate maybe was a little bit of a selfish choice. I did it because it felt good for me and it fulfilled something for me. And is that a little bit selfish? Maybe, but not selfish enough to be considered not altruistic, I suppose. Now, compensation, if we look at that definition, that means to give money in recognition of a loss, suffering, or injury incurred. And that's really interesting because when we look at these definitions of altruistic versus compensation, compensation seems to be the right thing that fits when we look at pregnancy, childbirth, potential risks, and losses that do happen in this process. But yet, these really strong core values of altruism in our legislation ensure that a woman cannot profit from using her body as a surrogate, despite the understanding that they are also taking on this assumption of risk for their body and family. So while we recognize that there is loss and pain and suffering, we are also saying that if that woman is compensated for those risks, she is selfish. And this is a really interesting concept when the law has no problem with all of these other very, very high surrogacy costs that are for profit. So let's look at why Canadian surrogacy is altruistic. Essentially, these laws were designed to prevent exploitation, which of course is a good thing, but it also made some really unfair assumptions that are not accurate about the surrogacy experience in Canada. Number one, it assumes that if a woman could be paid as a surrogate, that is the only reason she would do it. It also assumes that intended parents would exploit poor, uneducated surrogates who are desperate for money. And one step further is it kind of assumes that these easily exploitable surrogates who are only becoming surrogates for money are going to be passed by the clinic and social workers. But this is exactly the reason that we have all these guidelines in place for surrogates. Like they need to be financially stable and have a stable household and income. They need to have an adequate standard of living. So this idea of preventing exploitation almost makes it seem that if it was possible, the entire industry would exploit surrogates. But in a way, I feel like it almost is. Because if we look at the definition of exploitation, this is the action of treating somebody unfairly in order to benefit from their work. So while everybody else in the industry is paid and they exist because the surrogate is carrying this pregnancy, it kind of seems like preventing that surrogate from being paid in order for all of these other people to benefit from her work does create this sense of exploitation on the side of the industry, not necessarily on the side of the intended parents. So what does altruistic surrogacy mean for you? In practice, it means that surrogates in Canada have to have a receipt. You have to have documentation for these expenses, and you have to be able to reasonably justify that this expense was pregnancy related. And really, it's just a simple way of organizing the money that goes towards your surrogate in a way that is a reimbursement, not payment. But in a lot of cases, the amount that you're going to reimburse your surrogate is probably going to be around the same dollar amount that surrogates are compensated. And this is especially true if your surrogate has a higher income. Sometimes intended parents are under the impression that Canada is going to save them a lot of money here because it's reimbursement only. But you need to be prepared for a minimum of $25,000 to $30,000 towards your surrogate and be prepared that it could be higher. And because of these altruistic laws, there are very little restrictions on what can and cannot be reimbursed. So ultimately, it comes down to each match making choices in real time for their unique situation. Now, it's easy to see that some of these altruistic ideals can become exploitive under the right circumstances, but this is why it's important for you as intended parents to understand this so that you can make sure that your surrogate is adequately reimbursed for the things that she is doing in the pregnancy. So while you cannot hand her sums of money, you can make sure that all of her expenses are covered, that she's well taken care of, that she is comfortable and happy during the process. And this is what makes surrogacy in Canada more ethical. So now you know that while our public understanding of altruistic surrogacy would make it seem that there is no cost associated, this is false. So I hope that cleared up a little bit of our understanding about altruistic surrogacy in Canada. And just know that there are a lot of surrogates in Canada who have no problem with the reimbursement model. It is very easy to be able to submit these expenses and have them reimbursed. And if you as intended parents are prepared for those costs and understand what they are, this is going to go really smoothly for everybody. And this means that surrogates are not feeling exploited and intended parents are not feeling like they're taking advantage of somebody who can't be paid for their work. I've been working with Canadian intended parents for a while now, and because of the high cost of surrogacy to the many people involved in the industry, sometimes even small mistakes can add up to really large expenses. And sometimes the time it takes to get back on track is the biggest expense of all. Even doing research on your own can be costly because your time is valuable. And if you spend weeks and weeks researching only to find out that the information you found isn't accurate, you've wasted all of those precious hours. So taking this course is already putting you miles ahead and saving a ton of time because you know that this information is going to be research-backed, ethical, and the most up-to-date. So when we look at some common mistakes that can be really costly for intended parents in Canada, they usually surround the more costly areas of the surrogacy process. So this would be an agency, if you're using one, your clinic, your surrogate's reimbursements, and your contract. Now, even at good agencies, there are going to be people that didn't have a good experience. Just like at not so good agencies, people are still going to be able to go through the process and have their baby. But this is where your autonomy comes in to vet your agency so that you're not losing $20,000, $30,000 and needing to start all the way from scratch. The second area where there can sometimes be some unexpected costs is through your clinic. Now, your clinic is, of course, a necessary step in the process, but something that I've noticed about fertility clinics, specifically in Canada, is that they are very busy, they are sometimes overbooked, and they are typically understaffed. So what this means is that it's going to be really important for you to double check information and timelines and sometimes be on that clinic for the next steps. I can't tell you the number of times that I've talked to intended parents and surrogates who had to cancel cycles because the clinic didn't send their medication instructions on time, or the surrogate wasn't even on the email, so she didn't get the instructions. So you can avoid some of these expensive mistakes with your clinic by just making sure that your surrogate is on the emails, that they're following the timelines, that they are aware of cycles, and they're getting those results to you in a timely way. Do not ever be afraid to bug your clinic. You are paying them and you are there as a customer. So if you don't feel like you are getting responses in a timely way, follow up and keep emailing them and make sure that you are being on top of the information, because this is going to make sure that you don't have to cancel any cycles or wait months for results before you can actually get started. Another costly mistake is switching clinics because of surrogate preferences. So there are some clinics in Canada that will approve almost anybody, regardless of what our guidelines say. Sometimes it can be common to have it suggested to intended parents that they move their embryos to a bigger clinic so that they'll have a higher approval rate and it'll be easier to find a surrogate. However, you might not even want to work with that clinic or that doctor, and there are costs associated with the repeated testing and transferring those embryos and having to start somewhere new. The other thing is that moving your embryos to a clinic so that it will be easier to find a surrogate only means that there's a higher likelihood of matching with a surrogate that isn't qualified because they will be approved at that clinic. Your autonomy here is going to be your best friend and your biggest advocate. So I would avoid moving your embryos to another clinic unless it's absolutely necessary or unless there is a medical reason to maybe move those embryos to another clinic. One thing that you might find is that if you've already created embryos and the clinic that you are at does not work with surrogates, well, then you will have to move your embryos to a clinic that has a surrogacy program. But if it's just due to a surrogate preference, I would avoid doing that because you also don't know if you're going to continue to stay matched with a surrogate. And the last thing you want to do is move your embryos, that match falls through, and now you're at a clinic that you don't really want to be at. The next thing that can be a little bit costly is your reimbursements to your surrogate. And this is an area where some unexpected costs can come up. So while your surrogate's main reimbursement amount is capped, there are other things like bed rest and lost wages, which are not. Something that I've seen more commonly, and this seems to be more common at agencies, is surrogates being instructed to purposely go on bed rest early in the pregnancy. And sometimes this is an area of the contract is overlooked since it's not really that common that bed rest should be used. But bed rest expenses are high. Typically, these are a weekly amount that replaces things like lost wages, childcare, pet care, even household duties, so that if your surrogate was on bed rest for the safety of the pregnancy, she wouldn't have to worry about anything. Now, of course, that makes sense if your surrogate legitimately needs to be on bed rest. But if your surrogate is choosing to go on bed rest because it's easy to get a doctor's note, you could be paying $250 a week. You could be paying as high as $2,000 a week. And this is on top of her capped reimbursement amount. So part of understanding these reimbursements is being aware of some of these things that can potentially increase your costs. For the record, this is not okay. This is not standard, and it should not be happening. Bed rest is for the safety of the pregnancy. It's if the pregnancy is at risk. It is not to be used so your surrogate can pocket an extra $15,000 on the journey. So something to be aware of and something to think about that could be an increased cost. Now, if your surrogate's on legitimate bed rest or has particularly high lost wages, you can expect that amount will go a bit higher. But we can be prepared for that in advance and know what to kind of expect. The next area that can be a little bit unpredictable and costly are contract considerations. So in line with those reimbursements, there's certain contract things that can ensure that you're a little bit more financially protected. Things like being really clear in the wording, having amounts or ranges of amounts set out so that it's not just as high as it possibly could be. In the case of bed rest, something that I suggest in your contract is being able to get a second opinion. So if your surrogate chooses to go on bed rest, and maybe we don't think that that's as legitimate, you can have a second opinion worded in your contract. You can also have it worded in your contract that if that second and first opinion don't agree, that there needs to be a third opinion as well. This is one of those things that can prevent an area in the contract that can be easily exploitable by some surrogates. Another big one is, of course, making sure that you are in fact using a contract and that you are using 2 fertility lawyers, because a very big expensive mistake would be having to go back and forth in court because your contract wasn't done properly, or if one of you didn't have adequate legal advice. Being aware of some of these things is going to help you make better choices. It's going to help you be more informed in your journey. And ultimately, you're going to have a more successful experience in Canada when you know how to avoid some of these expensive and surprisingly common mistakes.